Now, Australia's most populous states, New South Wales and Victoria, have reintroduced COVID-19 curbs as daily infections hit new highs, driven by the Omicron variant. And this comes just before Christmas. Our correspondent Greg Navarro is joining us from Sydney. Hello there, Greg. How will Australians spend Christmas under the latest COVID-19 curbs?
Well, it really depends on where you live. I can tell you here in Sydney and across New South Wales, we have to wear masks once again when we're going into indoor settings. Use these things called QR codes, basically to check into businesses so that contact tracers can do their jobs. And density limits have been reapplied to hospitality and retail settings. The reason, as you alluded to, rising, surging number of cases, daily cases here in the Sydney area and across the state. To give you an example, just 7 days ago, we were dealing with cases in the hundreds. Today, more than 5,500 cases, primarily driven by the Omicron variant. Now, state leaders were reluctant to put in any restrictions. They were continuing this gradual easing. But the concern is that the hospital system, the healthcare system, would be overrun by the demands put on it by that many cases, and those cases just continue to rise, showing no signs of slowing. People living in Melbourne and Victoria as well, same thing applies, masks and density limits, as well as they deal with cases in the thousands. Queensland recorded a record number of cases on this day. Masks have been brought in to help out with that. They're also dealing with an increase in tourists, people coming from other parts of the country celebrating the holiday season there. South Australia was about to go into a reduction of some of the limits there. Instead, they've put that off until the beginning of next year. Again, rising case numbers, something they've had to deal with. Excuse me, I apologize. One thing that is really causing a lot of problems, people traveling to other parts of the country have to remember that Christmas Eve, an extremely busy air travel day. We're told that the flight route between Sydney and Melbourne, considered one of the busiest in the world, more than 80 flights have been cancelled on this day. The reason being, airlines are losing staff into isolation because of these mandates around COVID. You have to remember that if anybody's on a plane where there is a positive case, they have to go and isolate for 2 weeks. At the moment, the airlines, some of them that are affected, say they simply don't have enough staff to run these planes effectively.
Right, and Australian authorities reduced the wait time for booster shots from 6 months to 5. They're now saying the wait time will be shortened once again. What does the government think this will achieve?
Well, this all comes from an advisory group. It's called a TAGI, and it's an acronym. Basically, this group reviews vaccines for the federal government and makes recommendations. Initially, as you mentioned, after your second standard vaccine shot, you would then wait 6 months to get a booster. That was moved up recently to 5 months because of a surge in cases. There were calls, though. There are really a couple of reasons as to why they brought it up now to 4 months. Number one, here's something to consider, that most people over the age of 50 in this country have had AstraZeneca as their primary vaccine. Now, what they're finding, there are a number of studies that are showing that after about 3 to 4 months, its effectiveness really wanes, especially in the face of Omicron. So that's something that's a concern for those people, as well as people with underlying health issues. They want to get them vaccinated. Essentially, some in a case now where they're really very unprotected. The other thing is that the federal government wants to fortify everyone as much as possible in the face of all this, to help reduce the number of cases and reduce those surges that we're seeing, particularly here in Sydney and across this state. Now, that advisory group said, while it recommends shortening the amount of time that people have to spend between their normal shots and boosters, they said that boosters alone won't do it. Other measures need to be in place to help slow a surge in cases here.
Right. Well, Omicron apparently is creating troubles for all of us. And but Merry Christmas in advance, Greg. Greg Navarro reporting from Sydney.
You too. Thank you.
Well, in the Philippines, the government has approved Merck's COVID-19 pill for at-risk patients, and the waiting time for booster shot was also shortened to 3 months as a way to curb the more infectious Omicron variant. And for more, we are now joined by our correspondent Gretchen Malalat from Manila. Gretchen, Christmas is huge in the Philippines. How would you compare the mood of celebrations this year compared to the last?
Well, Dongning, here in Manila, you could feel the Christmas spirit in the air. The malls are packed and everyone is busy doing their last-minute Christmas shopping. Groceries are also packed. There are long lines of people buying food for their Christmas dinner. With the easing of restrictions this holiday season, there will be more people attending Christmas tonight compared to last year where masses were only held online. There were numerous Christmas parties held the past few days and families will be able to celebrate Christmas together. So the government has really ramped up vaccination and was very strict in implementing health protocols before the holiday so that the country can spend a merrier Christmas this year. So infections have decreased. Yesterday, there are only more than 200 cases reported by the health department. So cases have dramatically decreased. In September, we had a peak of 26,000 cases. So the decrease is because of the improved vaccine coverage and more vaccines available. Also, the health department has just announced that they are allowing adults to get their booster shots 3 months after their last 2 doses of COVID-19 vaccine. So more and more Filipinos will be protected, especially with the Omicron variant. Dongning, back to you.
Well, the Philippines has had it tough this Christmas indeed, dealing with both the COVID and the Typhoon Rai. What kind of Christmas can those in these typhoon-affected areas expect?
Well, Dongning, it's a somber Christmas for the people badly hit by the typhoon. There are 52,000 families that are now homeless this Christmas, and most of them will be spending it in the ruins of their houses or evacuation centers. Many may not be having any Christmas supper or any meal at all, especially in typhoon-hit areas that are still cut off or still can't be reached. For those who lost their loved ones, Dongning, the death toll from the typhoon has reached more than 300. And the families of the fatalities are still mourning. Some families will even be spending Christmas Day in cemeteries. So the Catholic Bishops' Conference of the Philippines, or CBCP, has designated December 25 and 26 as national days of prayer for families affected by the typhoon. So dioceses are urged to dedicate the Christmas weekend to pray for the recovery of typhoon areas. Parishes will be collecting donations, which will be given to the victims of the typhoon. But you know, Dongning, despite the tragedy, there are still many Catholic Filipinos in typhoon-hit areas who are attending dawn masses and they are keeping their faith strong. Churches which roofs were blown off still hold masses. So Filipinos are still trying to keep the Christmas spirit alive. Dongning, back to you.
Right. Well, really difficult time for the Philippines indeed. A Merry Christmas to you and to the Filipino people in advance. It was Gretchen Malalad from Manila.
Merry Christmas.